We'll start, Krati. Good luck, everyone.
Okay. Good morning and good evening, everyone. My name is Krati, and I will be the moderator for today's webinar. A warm welcome to all of you. I see a few people are still joining in, so let's give them a minute. In the meantime, I would like to quickly go through a few pointers. Please feel free to share your questions in the question tab. We will be addressing all questions at the end of the webinar. If due to paucity of time, we miss on answering any of your questions, we will be sending detailed answers to all the questions in the next couple of days. So without any further delay, let's start today's webinar. Just like the other industries, the COVID-19 pandemic dramatically changed how the healthcare industry functions. There are cuts in in-person visits to healthcare providers. To help fill the care void, many providers across the world are turning to digital alternatives, especially teleconsultation and therapeutic apps. However, this digital transformation comes with the major challenge of protecting patient and organizational data by having a foolproof cybersecurity strategy in place. Amongst these security challenges, ransomware is emerging as a primary threat towards organizations. Ransomware attacks against healthcare companies are increasing, leaving hospital and other care facilities vulnerable to cyber hackers' demands. According to a recent Sophos report, ransomware attacks on healthcare almost doubled. 66% of healthcare organizations surveyed were hit by ransomware in 2021, which is up to 34% in 2020. In today's webinar, we will try to integrate these seemingly distinct silos of digital healthcare and cybersecurity and understand that how can we overcome the security challenges posed by digital healthcare. Today, we have speakers representing both of these very important ecosystems, Mr. Suman Mishra and Mr. Kannan Srinivasan. Mr. Suman is a part of the global leadership team at GAVS and our Chief Technology Officer. He joins us with 20 plus years of rich experience in healthcare, financial, and pharmaceutical industries. Suman is a well-recognized leader for his many contributions to the healthcare and technological arena. For the past 14 years, he has been leading many healthcare initiatives that has had a profound impact on technology modernization and member health outcomes. Suman has expertise in digital innovations, AI and cloud in healthcare, social, clinical, and behavioral health, access to care, health equity, and more. Mr. Kannan is the cybersecurity head at GAVS. He comes with 20 plus years of experience and expertise in the areas of DevSecOps, cloud security, infra security, including SOC, vulnerability management, GRC, identity and access management, and more. He has several cybersecurity certifications like CGEIT, CISM, CRSC, and more. So let's start today's webinar with the poll. What is the level of awareness about ransomware at the leadership level within your organization? an active part of our strategy, of our IT strategy. So we've got some really interesting data here. And the second option, an active part of our IT strategy, is the winning one. So Suman, what do you think about this?
Kriti, thank you. And, thanks for inviting me to this webinar. I think this is a global audience. We have people from India joining, and we have people from the US. So warm welcome, good morning, good evening to all of you. When I'm looking at this poll and I'm just actually digesting the response, I wasn't actually thinking that people will go into putting that as part of their IT strategy, which is a great news, right? I think every time we look into these ransomware discussions, people, in my mind, and my opinion was always, they understand the nuances, they understand what the implications could be, but that may not have transitioned all the way to their IT strategy. What this audience tells us is actually it has happened. Maybe COVID had a big impact on it, right? But I'm very happy to see that people are not just aware of it, they're actually putting it part of their IT strategy. So very important point to ponder over as we move to the next discussion, which is about ransomware, right? But before we go into ransomware, I wanted to take a moment to talk about what is the impact of ransomware, right? It's how critical this is for the organizations. We're talking about healthcare here, but I think it is prevalent across the board, right? Let it be finance, retail, and any other industry. But if you look at ransomware in healthcare, as you scan through these numbers, the biggest one that stands out is the 20% increase in mortality, right? What that means is it could happen to patients when they are going through a surgery or a treatment or a procedure, and suddenly there is a ransomware attack, and the patients could die, right? And then that is probably the biggest issue, that people sometimes don't realize how deep this can cut through patient health outcomes and patient mortality. So that one is a biggie that stands out for me. But if you look at other numbers, right? I mean, delayed procedures and tests. Some procedures may not be elective procedures. Some are very critical procedures that the patient needs at a certain point of time. But if your organization is under a ransomware attack, you have to defer, it has to stall. And that is, again, direct impact to patient health outcomes. So as you see, a lot of organizations know what it is, they're probably prepared for it. And we will go through in detail in this presentation, which is very eye-opening for me personally when I went through this and said, there are so many things that we know, but we could do differently had we known this maybe 6 months ago or 5 months ago. So that is the awareness we want to create through this webinar. But healthcare security spend, I mean, I won't talk about it, but it's basically, as you can see, is 3 to 4% is not enough. So security can never be, in my opinion, an afterthought. It has to be baked into your strategy. It has to be part of your process. It has to be implemented through your people, process, and technology mechanism. So with that, the other question that comes to my mind is why healthcare, right? And I think why people target healthcare, where there is financial industry, which is, there's money to be made. Why do we talk about healthcare? That takes me to the next slide, which is what do attackers think in their mind when they talk about healthcare, right? There are only 3 reasons for anybody to attack a healthcare organization. First one is how valuable the healthcare data is. We often don't understand it. Let me quantify that. So if some person has a medical condition, let's say someone has diabetes or cancer, or has been going through certain treatment for like 6 months or more, a year, that is permanent data. When somebody gets access to that data, you cannot just unwipe that data. For example, if you get access to a credit card, you can wipe the credit card number, give a new credit card number, the hacker will never know. So, but in this case, that information out in public, that causes liability. I would say billions of dollars in lawsuits that every healthcare organization goes through at some point. And more importantly, it is the patient that gets the suffering the most, right? Both from a liability standpoint and other things. So that's immensely valuable. It also has other aspects to it. For example, it has demographic information. For example, they know where you live. They know which hospital you go to, what is your procedures that you have done in last 6 months and whatnot. That information is also very critical. And if you go to dark web, the numbers that I have seen is people are ready to pay 10 times more than a financial data versus in healthcare data to get that access, because it's so valuable, right? It's 360 view of the patient. So that's one factor for people like hackers to go after healthcare through ransomware. The second one is the legacy systems. Every healthcare organization, if you are in this industry for long, you would know and appreciate that they have not caught up to the digital transformation or cloud migration or any kind of modernization effort that any industry goes through. Retail and banking and financial services are way ahead of healthcare. But when you look into healthcare organizations, they're pretty much in on-prem and sometimes bare metal servers who have older operating systems, and they have challenges in upgrading and patching regularly those servers and scripting and running on those. So that's where I think the legacy systems are very, very vulnerable. So for a hacker to do that same attack and be successful in a finance industry would be much higher than compared to healthcare, because it's so open and vulnerable. You can get in pretty easily to majority of the hospitals. So that's one of the other factors that I think is a big issue. I personally feel healthcare industry is going to relearn. It is probably going to take some time for everybody to come up to the stack and say, we're ready for cloud, for example, or we're ready for the modernization effort. But until that happens, legacy systems play a bigger factor. Then the low awareness is as another factor, which I think is prevalent in healthcare, because clinicians are almost always thinking about patient health, treatment options, and with COVID hitting, people are also, the clinicians also looking at patients who are not COVID patients, but everybody else, and taking charge of their health and making sure there is no burnout that happens. And, there's so many balls to juggle and manage and monitor, that security and ransomware awareness is pretty low in that community. And that probably is one of the other things that you will see through the presentation, is how it plays a bigger role in terms of the training, the processes that any organization has established, and how they get vulnerable to those attacks. So I think this is critical for all of us to soak in, get grounded before we jump into the great discussion that Kannan is going to drive us through about how an organization should know these things, what are the signs, how things happen in real time, and what should we do to protect and proactively protect the organization from an ransomware attack. So without further ado, Kannan, would you take us through and educate us on this?
Yeah, thank you. Thank you. Hi all, very good morning, good evening. Before I talk about the solution, right, I want to go through some basics, spend some few minutes to explain some of the basic concepts, right? Right from just to set the context, what is a ransomware attack? It's a type of a malware attack in which the attacker looks and encrypts the victim's data, the important files, and then demand a payment to unlock and decrypt the data, right? So that's what the ransomware is all about. Now, so how do they do that? Is basically the attacker, they take advantage of human IT systems, network, software vulnerabilities to basically infect, the system, and they take control over it, right? That's about what this ransomware is all about. And there are multiple types of ransomware. To start with, it's about a crypto ransomware. So it's all about the attacker. He encrypts the file and data within the system, right? He makes the content inaccessible without a decryption key. So just to give you an example of this particular incident, the health plan of California, they face this issue, close to 800,000 plus the details of the individuals, were exposed. And then it's about the lockers. What they do is they just lock out the mission, and so that you as a user, you'll not be able to log into your machine. You'll just see a message saying like, your machine is locked out, pay this ransom so that, we'll release it. So this happened in the healthcare industry, like, in Vermont Medical Center, where close to 5,000 plus laptops, were locked out. The next one, which is the most critical one, is the ransomware as a service. So today, what is happening is ransomware is now, it's now available as a service. It's a subscription-based model that enables anyone with a bad intent, right? To take advantage of it, you'll be able to use those toolkits, and you'll be able to go after any organization or any hospitals. So you'll be able to use this, right? By doing it, they get a percentage of the ransom, that goes to the hackers. Now, why I'm keep repeating about this is any individual in your organization, they may not have strong knowledge in in the network programming or security, but they can opt for this service and they can cause harm to to any organization. Just to give you an example, right? DCH Health, they faced close to they paid more than $7 million, and so whoever was helping it, we're also paid a percentage of this amount. So you really have to be watchful about about the users, even your own employees, in terms of protecting against these kind of attacks. The next one is scareware, where they'll just say, okay, I have your data, right? I have 100,000 plus of your EHR, your data, and they will ask for a ransom, right? And last but not the least, it's a big doxware. It's all about I keep threatening, saying okay, I'm going to expose the personal data in the public forum, right? I just keep keep threatening you till you pay the ransom, right? So at a high level, these are the 5 key types of ransomware that you should be aware of. Let's go to the next slide, please. Thank you. Now, I'll briefly talk about the attack sequence, right? So it all starts with some kind of a loophole or an entry point in your system. The loopholes can be, I can start with a phishing email or a brute force attack, or use social engineering to get the credentials of your employees or users, and I'll be able to exploit that vulnerability, and to identify the loopholes and get into your system. Now that I gained an access into your network, the next thing I do is I do what is called as a network reconnaissance, right? And do the lateral movement. So what do I mean by network reconnaissance is, I get into your computer network and I'll just keep looking for the attack that I can do, right? I'll try to see what are all the open ports, how I can gain access into the other areas in your network, right? So that's what I do. And the moment if I'm able to see in your network, I'm in server A, from server A, I'm able to get access to server B, then I'll start doing what is called as a lateral movement, right? So once I'm able to get to multiple servers, and towards the end, if I'm able to get access to your the critical server where you have the patient's data or any personal data, right? Then I'll do what is called as a data exfiltration. So I will start getting those data. I'll send it to the hackers will take, they basically start collecting it and they send it to a different site. And then comes the actual ransomware. Like, I mean, they'll start encrypting your data so that you'll not be able to use it. And if you don't pay the ransom, they will start publishing this data in a public forum, right? So this is how the typical ransomware sequence works. Let's go to the next slide, please. I'll just take an example of the actual example that happened in the Ireland healthcare system, where it all started in somewhere in March 2021. Somebody was like, I mean, got a Excel file as an email attachment, right? And that led to like, I mean, they gave the credentials, and all it happened was like, I mean, they gained access to the healthcare system, and from then on, they started like, I mean, doing what is called as the lateral movement. They were able to get into the other servers, and they were able to get access to the healthcare records. And finally, they locked, or like, I mean, they encrypted the whole servers and exposed the data in the dark web. So if you look at it, right, like, I mean, it doesn't happen overnight. Typically hackers, like, I mean, or the attackers, they get into your environment, and they'll be there for like, I mean, at least a month to thoroughly understand your environment, where the data is stored. And they take the data out and then lock it. If you don't pay the ransom, they basically like publish the data in the dark web. So
yeah, I think one other thing I wanted to add here, Kannan, if I may, is
please.
this is something that the organization, healthcare organization, went through because it was a proven ransomware attack. In the wake of a WannaCry virus that was kind of wreaking havoc everywhere else, what I have seen in the healthcare industry, people do is a lot of reactive processes that take place. For example, active patching that goes on for weeks and sometimes months, because they realize suddenly that they're out of stack on certain areas, and certain servers are not even brought up to the tech stack standardization level. Some operating systems need to be upgraded, like some are Windows 2003, Windows XP versions sitting there. How do they go up to the latest versions? So I think there are a lot of preparatory exercise that goes in, which is not even part of the ransomware attack, but it causes so much pain and stress to the workforce that was supposed to do certain things. Now they put everything on hold because these things take over. So it's just an explicit impact that you're showing here. There's an implicit impact that you would feel in every organization when, let's say, company X got hacked or there was a ransomware attack. Company Y, looking at it, starts preparation because they haven't prepared their organization that way. That itself takes away a lot of time and effort and energy from that. I just wanted to highlight that.
Yeah, thank you. Thanks, Sumit. So let's move on to the next slide, please. Okay. So we would like to understand, it's a big poll question. We'd like to understand, like, I mean, is your organization ready to handle ransomware attack? So you have three options. You are not sure, somewhat ready, and you are 100% ready. Maybe we'll give you 30 seconds for you to respond. So as expected, like, I mean, many organizations today, right? Like, I mean, they are either not sure about, like, I mean, whether they have the adequate protection, or like, I mean, somewhat ready to handle it. But very few organizations, like, I mean, they are ready to tackle, if there is any ransomware attack. So there are tools in place, but what is really happening is either they are not tested properly, or like, I mean, it is not effective. And when it comes to the employee awareness, right, especially when it comes to hospitals, like, because you have be doctors and nurses, like, I mean, they may not be, very digital savvy, like, I mean, make them understand about some of the phishing emails, right? Like, I mean, it's definitely a challenge. So we'll talk through some of the areas, like, on how we can protect, the ransomware in your organization. So there are many, but we have taken the 6 key areas that will help you to protect your organization against the ransomware attack. The first one, like, I mean, have a strong adaptive authentication in place, a risk-based authentication, and making sure you have a complete view of all the applications, medical devices that is there in your organization, and you have put in adequate controls in place to protect them. Third one is on the list of all the third parties who have access to your system, what kind of data they access, and do they have adequate security controls in place, so that they don't infect your environment with any malware or any attacks. Next is on the software operations, where you have a qualified and a trained team who will look into all the alerts, look into your the endpoint servers, all the logs that are coming out of it, to identify and alert and prevent any attacks from happening. Next one is on the data protection. How do you protect your data? Like, I mean, taking right from the backups, encryption, and all those areas. Last but not the least, like, I mean, how do you train all your employees and your third parties, and they are well aware to identify, be it any phishing, or, like, I mean, even if there is any issues that is going on, like, I mean, they should be in a position to identify and report it to your security team. So these are the 6 key areas that we have identified. I'll walk you through, like, I mean, each and every one on how to protect it. So adaptive authentication, it's also called as a risk-based authentication, right? The very need for it is, if, let's say, for example, I'm the user, every day, I'm logging in from my office, I'll just connect to my the applications that I have, 3 to 4 applications where where I have access to, right? So in this case, the system should allow me to, like, I mean, seamlessly connect and work without disturbing, or, like, I mean, it should not take much time for me to work on it. Whereas today I'm in location A, but tomorrow if I travel to some other location, or if my ID is being used to log into the application from a completely different location, then you should be able to sense, like, I mean, the risk, and immediately, like, I mean, you should ask for further questions, or the multi-factor authentication, so that you'll be able to make sure that it's only the right person who is logging in. And in case if somebody is logging from a completely different location, or if you feel somebody is logging in at a time I'm not supposed to, then you should be in a block those connection, right? That's what we want to do as part of the adaptive authentication. It includes multiple technologies, like, single sign-on, multi-factor authentication. So all those, like, I mean, combined together. Let's move on to the next slide, please. So next one is on the medical and the application devices security. The first thing you need to do is, do you know all the devices that are there in your environment? What are all the applications, right? So this is the key. Like, I mean, is your CMDB updated? Do you have a complete view of all the applications and the medical devices in your environment? When it comes to application, do you have the process to first and foremost, like, I mean, have a threat modeling in place? Do you test your application, like, I mean, be it the code is being, like, I mean, tested using SAST, and before you deploy the code in production, do you do a penetration and the vulnerability assessment? So all those needs to be taken care, so that your application is secured and it doesn't, like, I mean, result in any vulnerabilities. Like, for example, like, I mean, be it SQL injection or any of these kind of vulnerabilities cannot be exploited by the hackers. Now, similarly, someone also talked about the medical devices. So medical devices, the biggest challenge today is many of them, they still are on the Windows 7 and those kind of an obsolete, platforms. So the vulnerabilities, right? What we see is are often not being patched. So if you don't have an adequate compensating controls, what really happens is it becomes easy for the hackers to take control over your medical devices. And as many of you know, these medical devices are often accessed by their product vendor to constantly give their inputs, or in case if any further analysis needs to be done, they connect to these medical devices from a remote location. So because of this, if you don't have an adequate controls, it becomes easy for any hacker or an attacker to gain control over the medical devices. Next one, please. So what I want to talk about or briefly touch upon is your third parties and the fourth parties, right? None of the organizations today, right? They can run the show, completely in-house. You have to depend on some of the third parties to support, be it, the application development or, running the billing system. So all those, it depends on some of the third parties, the contractors who is going to connect to your application. Either they are in your environment or sitting from the remote location, they connect to your environment to support your applications. Now, depending upon the type of the data that they have access to, what I mean by that is, if a vendor has an access to your patient's data, obviously you have to prioritize and make sure, you do a detailed risk assessment on how they connect to your environment. Do they have adequate controls in place? Are they using VPN, or how are they connecting securely? Have they done proper background verification of their employees? So all those needs to be assessed, and based on the vendor who have access to the data, you categorize them, and any of them, you have the, who are in the high risk, you make sure they put process and the controls in place to secure their environment, and they also have to make sure their subcontract, in case if they are using any fourth party, right? They also should adhere to these security controls. Constantly keep monitoring this. At least you have to perform a risk assessment once a year, so that there is no labs, or there are no new risk that is coming out from the third parties. Next one, please. So this is extremely critical, where all your the infrastructure components, right? Do you have a security incident and event monitoring tools, like for example Splunk or Sekion or Alien Vault, and those kind of tools in place that will constantly keep looking into your systems from the logs, try to understand if there are any incident that is happening, and then it will keep alerting your 24/7 monitoring team, so that they can take a action immediately. You also have to keep monitoring about the user behavior monitoring. Like I just talked about a user accessing from a completely different location. Let's say if I'm in India, and if I'm accessing from some location in South America, right? Obviously it's a red flag. So keep monitoring these kind of things and take a necessary action then and there, so that nobody can gain access to your system. Have a strong incident response in place, and make sure it is frequently tested, right? At least you do a tabletop exercise once in 3 months or once in 6 months, to make sure the the SOC, the infrastructure team are all well aware of how to handle an incident, and they don't really struggle, like, I mean, no, on the day when the incident is happening, right? So this is extremely key, like, I mean, for you to have a periodic validation and conduct a tabletop exercise. Next one, please. So this is all about data protection, right? When I say data protection, it includes right from making, is your data being encrypted? So how are we accessing your data? Like, I mean, through firewalls, do you have an adequate authentication mechanism in place? If I'm having the personal data and if I have to expose it, right? Like, I mean, am I doing a right level of masking? And at the end of the life, or like, I mean, let's say, for example, if I have to or use a data for like 7 years, or at the end of the retention period, do you follow the right process to purge the data and make sure, like, I mean, no, it is not available to any of the third parties or anyone, and you have to strictly follow this process so that nobody can take advantage or, like, I mean, gain access to the data. Next one is, how do you even take the backup, right? So the usual recommendation is at least 3 copies, 2 different formats, and you keep it in at least 2 different places. So what I mean by that is, if you have a production data, have a local replication, and you have a remote replication in place, keep it at least in 2 different formats. Let's say one is in a file format, like, I mean, you store it in tape, so that, like, I mean, even if something goes wrong, you'll still be able to recover your data without any issues, right? So that's all about the data backup and the data protection strategy. Next one, please. So this is extremely key in terms of the training and awareness, right? At least, once a year, you need to have a detailed training program for all your employees on the information security, data privacy. Every 3 months, right, conduct a phishing simulation. This is mainly because your employees should be, able to identify if there is any phishing. I mean, just send an email saying, like, okay, click this link, because one of your patients, like, I mean, is wants this particular data urgently. Just click on it, and then, like, I mean, please share your inputs, or, like, I mean, your recommendation. So what happens is, if someone who is not aware of these kind of phishing emails, then immediately they click on these emails, they share their credentials, and as a result, like, I mean, that becomes a easy entry point for hackers to get into your environment. But training users alone is not enough. It's also have to take care of the team, the security team who is monitoring, right? Like, I mean, they also, like, I mean, constantly have to train them on how to deal with these kind of phishing emails, how they should, like, I mean, identify and protect the organization. And if I report a phishing email, like, I mean, are they able to contain it and it doesn't go to all the other users, right? So this is what you need to do as part of phishing simulation. Last but not the least, like, I have a good governance structure in place so that these training are, like, I mean, happening properly, and you are covering the topics that are relevant and that is the need of the hour, making sure all the people are covered. Usually we do what is called as a test at the end of the training program. So make sure, like, I mean, all of them have at least 80 to 90% of the marks, they score. So that these are some of the things, like, I mean, that we need to take care as part of the governance activities. Suman, you would like to add anything from the training, from your experience in healthcare? Would you like to add anything here?
Yeah, I can. I think a couple of things that I would like to point out is, like I said in the beginning, people are decently aware about ransomware. phishing, security, right? And I think as you saw the audience poll that we received, majority of them actually are trying to incorporate or have incorporated the security as part of their strategy, right? IT strategy. So it is not an afterthought. Where I think organizations can do a better job, I'm not talking about a specific one, but in general, is reinforcement of these trainings. So in my previous organization, when we saw phishing, it's a very boring topic to many, right? I think people say, oh, yeah, sure, security, phishing, I know about it. But when you make it more intuitive, like there was a fun element added to the training. For example, the animation that was created is going to stick to your head for a long time, because the way they were showing how attackers kind of trick you, and you feel like you've been cheated or robbed of something. But that visual, that animation kind of stuck with us, right? So every time we go and click on a link, we will look at the link and say, oh, this could be a phishing test. And people started competing with each other, saying, I have safely dodged 5 phishing emails that was sent by our phishing team and in our security team, right? So that is one of the key areas where I think you could make it interesting, make it more palatable for people to understand and appreciate the importance of it, and then act on those recommendations. So that's one area I would say. Training doesn't have to be boring. It could be interesting, showing the impact in a more fun way for people to do that repeatedly. The second is, like you said, the governance piece. If you clicked those things twice and you failed the phishing test, your manager gets notified. That means it's an implicit obligation for you now to go back and take the phishing training again until you are clear in terms of what you know about phishing and how you act in your daily job and avoid phishing tactics trained by and sent by the intruders. Now, that itself is a big deal because a lot of people were not aware of the implications of getting caught in the phishing test. So the security team had to build that in a very nice way. Like, they're sending you a $500 game ticket or something, and you click on it and you got caught. And those, again, doesn't have to be boring. They could be fun, interactive, but at the same time show you the value of not getting caught and protecting the organization, right? So at the center of it, like you showed, Kannan, is people, process, and technology. All three need to be checked in a meaningful way so that you're not just protecting the data from a technology standpoint, you're also building a process to make sure the organization is aware and the people actually are knowledgeable to basically implement that. And then it's part of their routine. Every time they do something, they think or they doubt or they suspect that email saying, is it going to cause me more harm if I did this versus that? So yeah, I think that I'm just making a point, but I think that itself is ignored multiple times in many organizations.
Yeah, well said, Suman. Thanks for that. And let's move on to the next slide, please. So where the market is heading towards, right? When it comes to ransomware protection or even from the security control per se, right? Today, the zero trust model, it's becoming more popular, and many organizations, I know, you started implementing some of the zero trust principles. So what is a zero trust architecture is never trust and always verify, right? That's a fundamental principle of the zero trust. You have to assume, right? Everything is a hostile in your environment by default, and there is going to be a compromise at each and every stage, right? So the zero trust model, right? It takes into account your network, the infrastructure, the identities, all the devices, application, and the data, right? It assumes there can be a compromise in any of these areas. So all you need to do is, if I connect to your environment, right? If I'm in the external network and I connect through the VPN, you should not just take care of check whether it's the right user who is connecting to the environment in the VPN and allow them to access. And once they are into your network, they have access to the entire network, right? That should not be the case. You check at each and every stage whether it's the real and the user who is accessing the system. Same thing you need to do when it comes to accessing your application. When I get access to your data, all you need to do is always make sure whether it is the right person who is accessing, always ensure, validate, and apply the least privilege principle, so that you don't give the complete access to the user. So how do you build a good zero trust model, right? Like, I mean, it's a 4-step process that the industry currently recommends. One is identify all the users and the devices that attempt to connect to your network, right? This is the key, meaning you need to have a good control of all the assets that is trying to connect to your environment. Have a good access control mechanism in place. I explained it already about the adaptive authentication, right? I mean, using the principles of multi-factor, SSO, and all those. So make sure you have a good authentication mechanism in place. Deploy tools that will continuously keep monitoring, right? Of any issues in your network or any malicious behavior. You should be in a position to detect and take necessary steps to contain it. Last thing is, like, I mean, make sure you check all the remote access and make sure only the proper security controls and authentication, everything is there in place. Keep testing your environment every on a periodic basis. So this is what you need to do as part of the good zero trust model implementation. So by doing this, you'll definitely be able to minimize the impact and reduce the risk in a much better way. So this is what I wanted to highlight from the zero trust model. Let's move on to the next slide, please. Yeah, we'll take question and answers.
So thank you, Kanan and Suman, for this very interesting and a very insightful perspective that you gave. There is one immediate question that I got in mind. Is zero trust model actually implemented?
Is zero trust model actually implemented?
Does it actually, because it's like zero trust. I mean, people.
Okay. So
does it actually work that well?
What's happening today, is not all the organizations have adapted or implemented zero trust, but there are many organizations, like, I mean, they've started doing this, like, I mean, especially when it comes to the network and other areas, like, I mean, they've already started implementing some of the features. See, some of the players, like, for example, Netscope, Zscaler, they are all, like, I mean, have a very good tools to help protect an organization, and they use the zero trust principles, right? So the answer is, like, I mean, yes, many organizations have started adopting this, and some of the organizations are yet to catch up, and they are already working on implementing these.
Okay. So we have a lot of questions from the audiences in the pipeline. So we're taking it in the order that we're receiving it in.
Yeah.
So one question is, this one is for you, Kannan. So how the Linux systems are safe against ransomware?
So it's not fully secure, right? Like, I mean, I've seen multiple instances where Linux machines were also got compromised. So all you need to do is, as I mentioned earlier, like, I mean, the controls I just explained earlier, right? I mean, having the right authentication, the logs are, like, I mean, you have to get the logs, monitor it in the SIEM tools, and the most important thing is, like, I mean, backup. I can't stress it enough. Like, I mean, you have to take the backups in the right frequency, so that even if something happens or if your mission is locked out, you will be able to recover it in a much short span of time.
And I think the answer, probably, if I may add, right? I think the answer is it's not about the operating system in general. It's also about the process that goes around it. I think what we have described throughout this is how you would take care of the data, which may not be part of your operating system, but it kind of connects easily. So you cannot say Windows is better than Linux or Linux is better than Unix, for example. Rather, looking at, do you have a comprehensive mechanism in place so that at any given point, it is not about one thing, but everything that is part of it. Like the 6-step process that we kind of laid out, that probably covers it. So you may have a Linux operating system, but that does not make you secure, is what we are trying to say.
That's it.
Right.
Okay. Another question that we've got from the audience is that in the market, all endpoint companies are promising to customer for a secure network from ransom. So what is your opinion of which endpoint is recommended by you?
That's a, how would I put it? Like, I mean, see, some of the newer endpoint tools, like, for example, be CrowdStrike and tools, right? Like, I mean, they are really good, but I don't want to, say that, like, I mean, these are the only one or two, but most of the tools today, right, be it all the XDR tools, like, I mean, are they really have good controls to protect. But all you need to do is make sure your endpoints are they are you have the latest version of the data, right? Like, I mean, and those missions, are they, like, I mean, can your SOC team, will they be able to monitor those endpoints, and will they be able to get an alert if something is going on? Last but not the least, like, I mean, patch it regularly, right? Do you have the right tools to patch your endpoints? That is key, right? So if you do that, it will protect your endpoints to a large extent.
Okay. So another question for you, Suman. So the audience is asking, how do we build a good training program for ransomware awareness?
Yeah, and I think, like I said, training and security should not be an afterthought. It should be always baked into the strategy itself. So I think there needs to be investments made for strengthening the security of the entire organization. When you do that, it's my opinion that the training is front and center of all of it, because you may have a good strategy for security, but if that is not implemented at the right level, including governance, including people and their knowledge about security in general, forget about ransomware, but in security in general, I feel that the organization can boast of having a strategy, but not able to implement and still be vulnerable to the same issues that we saw. So the response to your question would be, first, allocate certain amount of budget for training in security in general, and then you can talk about phishing, ransomware, and a lot of other things, right? That can come in handy. Make it periodic, so it is not just once and done once per year, right? You did it and then you forgot about it. It has to be continuous. And then, like we said in our presentation, the monitoring piece is critical and the governance piece is critical. So you keep monitoring and test their knowledge as they go through. So any given time they do not remember or have a gap in understanding, their management gets involved, and it's taken seriously within the organization, right? So there is a process to put them on the right track by giving more training for people who have not understood or haven't acted in a certain way that the organization demands. So the answer is all of it, but it just has to be in a very structured way of training, monitoring, and governance with the clear funding upfront, saying this is non-negotiable. We got to do this throughout the year, right? That's I think is important.
Like, I mean, you review the course, right? At least, like, I mean, are you giving the relevant course material to your teams, right? That is more important. let's say, for example, ransomware was not many people know about ransomware, or it as part of your training program, you might not have covered ransomware at all, right? So look at the relevance, like, I mean, what is happening, what are the key risks in the market today, and make sure you address those risks in your, the training, so that people know about it, they know how to react when the situation arises. Do the simulation, right? Like, I mean, if it is a phishing or those kind of things, like, I mean, make sure you at least test it once in 3 months, or like, I mean, do the phishing simulation every 3 months, so that people, even though they have studied or they know they took the test in the past, right? Like, I mean, there is always a validation mechanism, like someone said.
Okay. So there is one more question. Do we have any group to share and alert the IT person on latest ransomware? How to take preventive measures on that?
Do you repeat that question? Do you have any?
Do you have any group to share and alert the IT person on latest ransomware? How to take preventive measures on that?
Okay, so first thing you need to do is in an organization, right? Like, I mean, so if you have a security operation center team, right, that should be the first point of contact, and you need to have a group, right? Like, I mean, incident management handling team, where that comprises of these key stakeholders, infrastructure team, and the application owners, right? Like, I mean, part of it. So that's what you need to do as part of it.
Okay. So I think in the interest of time, we can take one last question. So how is AI ML being used in cybersecurity to prevent ransomware attacks?
Okay, that's a good question. So today, what is really happening is, I mean, the AI and ML, right? I mean, they are widely being used in some of the, let's say, for example, if it is SAEM tool, right? I mean, earlier it only used to aggregate the logs, and it just it gives that in the dashboard. So today, what is happening is, it is able to analyze and try to see, like, I mean, is there any issues that is going in your system? Is there any hacker who is there in the system? Like, I mean, is there any lateral movement that is happening? So it is able to predict, and it goes even one step ahead. Like, I mean, we have what is called as a SOAR, right? Like, I mean, it's a security orchestration tool. For example, Exabin and those kind of tools, like, I mean, they are able to take an action if there is any lateral movement, or if there is any incident that is happening. It is able to take an action then and there, and protects the other systems and servers in your environment. So what is really happening is, it is able to understand, like, I mean, what is happening, and it is able to take the necessary actions well ahead. So that's what is really helping, and it is able to reduce the incidents in a significant way.
Yeah, and Kanan, I was thinking, when we are looking into these policies and the predictive ability of the software to say, this is more vulnerable than that. Is it always rule-based, or is it intelligence-based as well, or both, right? I mean, I think that's probably the distinction, isn't it?
It's a combination of both, meaning number one, it has to get that intelligence, and second thing is, like, I mean, have you configured it in the right way, right? If your rule is, you're not factored in some of these, right? Like, I mean, definitely, your system may not alert at the right time.
Right, because when we will design any system, and this applies to the audience here and others, I think the idea here is not to just go by rule-based, because you may not be right all the time, and not always go by intelligence-based, because their data set kind of drives the intelligence too. So like you said, maybe you learn and adopt, and you basically cross-check and cross-validate if those were the right rules in place based on the predictions, and maybe that's where the organization moves forward, right? All right, cool. I think we're at time. Kriti, back to you to close it out.
Yeah. So as we draw to the conclusion now, so I would like everyone to know, whoever's question were not answered, we'll reach out to you in the next couple of days with a detailed answer. So to sum up today's conversation, the growing rate of ransomware attacks in healthcare is a big concern, and failing to build a cybersecurity program could lead to serious repercussions both at individual and organizational levels. Identifying bad actors within an organization is also becoming increasingly important as ransomware as a service is on the rise, and building a robust cybersecurity program with laid out training and awareness program is a must along with other security measures. People, processes, and technology is the heart of cybersecurity, and all three have to work in a tandem to achieve cybersecurity goals. Thanks again for joining us, Kanan and Suman. If anybody wants to discuss more in detail about this topic, please let us know in the survey form followed after this webinar, and we will reach out to you, or write to us at inquiry@gavstech.com. Do check out our website, gavstech.com, for some actual use cases and articles. Thank you and take care.
Thank you all.
so much. Take care.
Bye.
Bye.
Thank you.